My name is Dr. Tushar Mahendra. I work out of my office here in Cambridge, Saginaw Dental Center. And as we all know, recently our whole profession has been kind of facing this challenge with the COVID-19 infection that's been spreading, and how do we control it in our operatories. There's been a number of measures that have been introduced, like we wear the face shield, we have these scrubs on, a lot of bulky protocols to follow, which make providing treatment a little challenging. So today we're going to try this new product, the Genius Shield, which looks like a genius idea. Alright, as you can see here, we're set up with the Genius Shield to do a aerosol generating procedure, which is where most of the threat of transmission through aerosol comes from. Normally we would have to wear a bulky face shield that makes things quite difficult to operate. The light reflects off of it, it gets pretty hot. So this should be an improvement over that. We have the suction hooked up, we have the shield in place, which is adjustable, right? It swivels around to suit your access, and of course we have the arm that is also adjustable. So as you can see, access is pretty good. There is no reflection from the light on my loop, which is a big problem with the face shield, at least for me. Things are looking good, but we're going to do a procedure on the bottom left side. So let's take the Genius Shield for a spin. So here we are. So you can see, access is not a problem. And I think this is a huge improvement over the face shield, because I can still breathe and be comfortable while I'm doing this all day. So another thing I noticed with my face shield is that because it gets humid in there and it's hot, there's a lot of fogging, and that could be a big problem when you're scrubbed up and wearing an isolation gloves and an N95. There's absolutely no issue with the fog. I can keep going without worrying about visibility. So the other thing is, access for me is absolutely unhindered. I can move around without having to worry about the shield being in my way. Mel, what do you think? How does it feel?
I think it's great. Access is great for me as well. And I don't have to wear that visor, so it's not so hot.
So the other thing that was a concern to me is I'm putting this huge disc over my patient's face. How is he going to feel about it? Is he going to feel claustrophobic, closed in? So let's take a minute to ask him. Let's take a second. Ron, how do you feel, man?
It's really good. I don't feel anything different. It's really nice.
Okay.
How I feel like this.
Perfect. That's great.
That's great.
So does it feel like you're closed in, or does it feel claustrophobic to you at all? Or
No.
Okay, good.
Really
Well,
good.
That's perfect.
Perfect. That's good. So as you can see, we've actually added an extra layer here, a curtain with the shield, which is a really nice feature, because now the aerosol is, what looks like to me, completely contained inside this shield area. And if there was any concerns about dispersion of the aerosol in the operatory before, this should put that to rest. So adding the curtain on doesn't really affect the accessibility. I could just sneak in underneath, and it lifts up very easily. So there's no concern with that. There's still no splatter, no splash, making vision difficult. There's no fogging up. In fact, I feel even better with this on, because I know that nothing's getting out of there. So, in the end, I'd like to say I really enjoyed using the Genius Shield. I think it's a great product. So my name is Dr. Tushar Mahendra, and I practice at Saginaw Dental Center in Cambridge, Ontario, and I love using the Genius Shield. It's an amazing product.